Something very small as a tick or a flea, can put your dog's life at risk. Can you believe it? These parasites are responsible for very serious diseases that can turn your pet's life into a real nightmare. These diseases silently attack your dog's organism, destroying blood cells, compromising the immune system, and causing severe anemia. The most frightening thing is that symptoms may not appear immediately, and when they finally manifest, it's often too late for simple treatment. Thousands of pets suffer unnecessarily every year because their owners didn't know how to protect them adequately. The consequences go far beyond the animal's suffering. Emergency treatment costs can reach thousands of dollars, not counting the emotional suffering of seeing your companion fighting for life. Some of these diseases can also affect humans, putting the entire family at risk. The good news is that all of this can be avoided with the right prevention measures. Before we begin, please leave in the comments your name and the city where you're watching our content from. We love to know where you're following from. In this video, we'll show you 7 simple and essential steps to protect your pet from these silent threats and avoid suffering expensive treatment costs and risks to your family's health. Step number 5 is extremely important, and unfortunately, owners don't always follow it, but we'll explain why it can make all the difference. Step 1. Understand the risks and diseases they transmit. Let's start by explaining why these small parasites are so dangerous. Ticks and fleas are not just annoyances that cause itching. They are vectors of serious diseases that can lead your pet to death if not treated adequately. Ehrlichiosis, known as tick disease, is one of the most feared by veterinarians. This infection directly attacks your dog's blood cells, causing severe anemia, clotting problems, and immune system compromise. The infected tick needs to remain attached to the animal for only a few hours to transmit the disease. Babesiosis is another serious condition transmitted by ticks. This disease destroys red blood cells, causing severe anemia, high fever, and can lead to vital organ collapse. Young and elderly dogs are especially vulnerable to this condition. Hemobartonellosis, transmitted mainly by fleas, affects red blood cells in a similar way. This disease can remain dormant in the animal's organism for years, manifesting only when the immune system is weakened. Allergic dermatitis caused by fleas deserves special attention. Many dogs develop allergy to flea saliva, resulting in intense itching, open wounds, secondary skin infections, and significant hair loss. A single flea can cause extreme discomfort in sensitive animals. There's also the risk of indirect transmission to humans. Some diseases transmitted by these parasites can affect family members, especially children, and people with compromised immune systems. Prevention in your pet protects the entire house. Step 2. Recognize the signs that can tell you if your dog is suffering. Knowing how to identify the first signs of infection can save your pet's life. Many owners lose precious time because they don't recognize the initial symptoms of these diseases. Fever is usually the first warning sign. If your dog is quieter than normal, without energy to play or walk, this may indicate fever. You can check by gently touching the animal's ears and nose. If they're very hot or very cold, it's time to measure the temperature. Loss of appetite is another concerning symptom. When a dog that normally eats well suddenly refuses food or eats very little, something is wrong. This symptom, combined with apathy, should be taken seriously immediately. Observe your pet's gums regularly. Healthy gums are pink and moist. If they're pale, white, or yellowish, it may indicate severe anemia caused by parasites. Purple or reddish spots on the skin, especially on the belly and paws, are also warning signs. Excessive itching is obvious when it comes to fleas, but pay attention to the pattern. If your dog scratches compulsively, especially at the base of the tail, neck, and behind the ears, it may be infested. Open wounds from scratching too much can become infected quickly. Subtle behavioral changes are also important. A dog that's normally sociable and suddenly isolates itself, or that shows irritability when touched in certain areas, may be feeling pain or discomfort caused by parasites. Accelerated breathing, tremors, vomiting, or diarrhea are signs that the infection may be advanced. In these cases, veterinary consultation should be immediate, as time is crucial for effective treatment. Step 3. Daily verification through the affection exam. Transforming your pet's inspection into a moment of affection is one of the most effective prevention strategies. This simple habit can detect parasites before they have a chance to transmit diseases. Establish a daily routine, preferably after walks or outdoor activities. Start by gently petting your dog's entire body, paying special attention to areas where parasites most like to hide. The neck, especially behind the ears, is a favorite spot for ticks. The armpits and inguinal region are warm and protected areas that ticks love. Pass your fingers carefully through these regions, feeling for small lumps that could be parasites. Between the paw toes is also a common hiding place, especially for young ticks. The ears deserve special attention. Gently lift the ears and examine both the inner and outer parts. Ticks can attach inside the ear canal, causing serious infections. A strong odor or dark discharge may indicate problems. If you find a tick, never pull it with force. Use fine tweezers, grab the parasite as close to the skin as possible, and pull slowly with straight upward movement. Avoid twisting or crushing the tick, as this may cause mouth parts to remain stuck in the skin. For fleas, use a fine comb specific for fleas. Comb against hair growth, especially at the base of the tail and neck. If you find small black dots that look like dirt, place them on wet paper. If they turn reddish, they're flea feces. After inspection, always wash your hands well and disinfect any tools used. Keep the environment clean and properly dispose of any removed parasites. Step 4. Continuous protection through the use of effective antiparasitics. Chemical protection is your strongest line of defense against parasites. Understanding the different types available and how to use them correctly can make the difference between a healthy pet and serious health problems. Anti-parasitic collars are convenient and offer long-term protection, usually between 3 to 8 months. They gradually release active ingredients, creating a protective barrier around the neck that spreads throughout the body. They're ideal for dogs that don't like topical applications. Pipettes or spot-on are applied directly to the skin, usually between the shoulder blades. They offer systemic protection and are absorbed into the bloodstream. Most protect for 30 days and are effective against a wide range of parasites. They're especially useful for long-haired dogs. Oral tablets are becoming increasingly popular. They act from the inside out, killing parasites when they bite the animal. Some offer protection for up to 3 months with a single dose. They're ideal for dogs that swim frequently or live in very humid environments. Sprays offer immediate protection and are useful for application before walks in high-risk areas. However, they need to be reapplied more frequently and can be difficult to apply uniformly on dogs with dense fur. Protection should be continuous, not just during certain times of the year. Many owners make the mistake of interrupting protection in winter, but parasites can survive in heated environments inside the house. Consistency is fundamental to keeping your pet safe. Combine different methods when necessary, but always consult a veterinarian before using multiple products simultaneously to avoid overdose or adverse interactions. Step 5. Environmental care. Eliminate the source of the problem. This is the step that many owners neglect, but it's absolutely crucial for effective parasite control. You can protect your pet perfectly, but if the environment is infested, there's nothing to be done. Contamination is inevitable. Only 5% of the flea population lives on your pet. The other 95% are in the environment, developing in carpets, floor cracks, sofas, and especially in the animal's bed. The adult fleas you see are just the tip of the iceberg. Regular house cleaning should include frequent vacuuming of all carpets, rugs, sofas, and areas where your pet spends time. The vacuum's vibration stimulates flea egg hatching, helping to break the parasite's life cycle. Immediately dispose of the vacuum contents or use specific products in the bag. The pet's beds, blankets, and toys should be washed weekly in hot water, above 140 degrees Fahrenheit. This temperature kills all flea development stages. Use a dryer on high temperature whenever possible. Environment-specific products are fundamental. Residual sprays applied to cracks, baseboards, and pet resting areas create a lasting barrier. Some contain insect growth regulators that prevent larvae from developing into adults. Outdoor areas cannot be forgotten. Gardens, yards, and especially shaded and humid areas are ideal breeding grounds for parasites. Keep grass short. Remove accumulated leaves, and consider using beneficial nematodes, which are natural enemies of flea larvae. Environmental control should be continuous for at least 2 months to completely break the parasite life cycle. Patience and persistence are essential in this process. Step 6. The veterinarian's role in prevention. Regular veterinary follow-up is irreplaceable in preventing diseases transmitted by parasites. Professional knowledge can identify specific risks for your pet and the environment where it lives. Routine consultations should occur at least twice a year, even for apparently healthy animals. During these consultations, the veterinarian can detect early signs of infestation or infection that would go unnoticed by the owner. Periodic blood tests are especially important for dogs living in high-risk areas. These tests can detect diseases transmitted by ticks even before symptoms appear, when treatment is more effective and less costly. Each pet has specific needs based on age, breed, health status, and lifestyle. A dog living in an apartment has different needs from one that spends a lot of time outdoors. The veterinarian can recommend the most appropriate prevention protocol for your specific situation. Personalized evaluation takes into account factors such as known allergies, medications the animal already takes, and history of adverse reactions. Some dogs may need specific products or special anti-parasitic combinations. The professional also stays updated on new products and resistances that may be developing in the region. Parasites can develop resistance to certain active principles, making it necessary to change prevention strategy. Regular updating of deworming and vaccination works together with external parasite control, creating a complete protection shield for your pet. Step 7. Prevention is also love and care, so create a healthy routine. Truly effective prevention goes beyond chemical products and cleaning. It involves caring for your pet's general health, strengthening its natural immune system, and creating a bond that facilitates early problem detection. A balanced and quality diet provides the nutrients necessary to keep the immune system strong. Well-nourished dogs have greater resistance to infections and recover more quickly when exposed to parasites. Consult your veterinarian about the most appropriate diet for your pet. Regular hygiene routine not only keeps your dog clean, but also strengthens the bond between you. During bathing and brushing, you have the opportunity to carefully examine the animal's entire body, detecting any changes quickly. Adequate exercise and stimulating mental activities keep the pet healthy and happy. Stressed or bored dogs have compromised immune systems, making them more vulnerable to diseases. The balance between physical activity and rest is fundamental. Daily attention dedicated to your pet creates familiarity with its normal behavior. Small changes that could go unnoticed become obvious when you know your dog's habits and personality deeply. A stable and loving family environment reduces the animal's stress. Sudden changes in routine, excessive noise, or tension in the house can compromise the pet's natural resistance to parasites and diseases. Remember that prevention is also a demonstration of love. Each moment dedicated to preventive care is an investment in your four-legged companion's health and happiness. Ticks and fleas may seem like just small annoyances, but they carry real and dangerous threats that can turn your pet's life into unnecessary suffering. The diseases these parasites transmit are serious, expensive to treat, and can be fatal if not detected in time. With these 7 steps we just shared, you have all the necessary tools to prevent serious diseases, avoid unnecessary suffering, and ensure your pet lives with health and safety for many years. Prevention is not just about products and procedures. It's about creating a care routine that strengthens the bond between you and your companion, keeps them healthy, and demonstrates the love you share. Because those who love, care, and prevention is the greatest act of love you can offer your pet. Start implementing these steps today and give your dog the protection it deserves. If this content was useful to you, leave a like, share with other owners, and subscribe to the channel for more pet health tips. Your four-legged companion thanks you.